Okay, this is our presentation on gonorrhea by Brazil Yates and Shakira Sebastian. So basically, we just went around campus and interviewed students on their prior knowledge of gonorrhea. Like, we just wanted to see what they knew, or if they knew anything about it, or had any knowledge or anything on the topic. We're going around campus asking students what do they know about gonorrhea and if they have any awareness. Gonorrhea. Any facts, any information, any prior knowledge?
All I know is that it's a sexually transmitted disease and it can be transmitted on the mouth and the vaginal area and the penis area. That's about it.
Okay. What I know about gonorrhea is that it's a bacterial infection and that you could get it through having intercourse.
Okay, gonorrhea is an STD that's only sexually transmitted. You can't get it from kissing.
The symptoms of gonorrhea is burning, itching, pain while urination, and you have a white discharge.
Anything else you want to say about gonorrhea?
It's a scary STD.
Okay, so the next thing that we're going to go into is what is gonorrhea. Gonorrhea is a common sexually transmitted disease, also known as a STD or bacterial infection that can be infected to both males and females. It can cause infections in several areas such as the genitals, rectum, and throat. This is a very common infection, especially among the younger age group of 15 to 24 years of age. Fun facts about gonorrhea is that gonorrhea is sometimes referred to as the clap, drip, dose, strain, gleat, or the whites. Gonorrhea is caused by a bacteria known as Neisseria gonorrhoeae. This bacteria is also carried in many different animals. How is gonorrhea spread? You can transmit gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. It could also be transmitted to other unlikely parts of the body. A pregnant woman with gonorrhea can give the infection to her baby during childbirth. Also during childbirth, if gonorrhea is left untreated, it can cause eye and joint infections on the baby during delivery. Gonorrhea symptoms in males: discharge from the penis, may be thick, milky, white, yellowish, or greenish color, frequency upon urination, burning sensation upon urination, painful or swollen testicles. The time span of symptoms begin to appear in males usually 2 to 5 days or anywhere up to 30 days after the infection. Some other symptoms include itching, soreness, and bleeding. As you can see in the photos, there is discharge dripping from the penis. This could easily be mistaken for semen. That is why it is important for you guys to get checked. Untreated gonorrhea can lead to different complications in males. One of the most known complications is epididymitis, which is known to be swollen or tender testicles. The pictures below shows different variations. Gonorrhea symptoms in females. Most are asymptomatic, which means it shows no signs or symptoms, or can cause painful urination, abnormal uterine bleeding, or pain during sexual intercourse. Severe cases of normally turns into pelvic inflammatory disease. Pelvic inflammatory disease is also abbreviated as PID, which is also a disease that can cause infertility. Infertility is when there's damage caused to the reproductive organs. Signs and symptoms of pelvic inflammatory disease is low abdominal pain, fever that exceeds 100 degrees, nausea and vomiting, pain during intercourse, back aches, infertility, and chronic pelvic pain. How is gonorrhea treated? It is treated and cured with antibiotics. However, many strands of disease has become resistant to some antibiotics over time. Therefore, it is very important that people complete their entire medication regimen until it is done. First, there are different types of tests that can be done, like a urine test or swabbing of the throat, penis, or cervix. Different strands of gonorrhea are continuously increasing because of the resistance against antibiotics. This can make treatment difficult where reinfection can occur if you do not take all the antibiotics prescribed. Risk factors that can lead to having gonorrhea: having unprotected sex, sex with multiple partners, sexual assault known as rape cases, substance abuse, which is when someone is overly intoxicated and may not be aware of what is going on and might have sex with someone, and a long history of STIs.
Okay, so for the first bullet in 2013, it states that Delaware was ranked number 6 among 50 states in gonorrhea infections. So this is 151.6 per 100,000 persons. For the third bullet, it says in 2013, 763 reported gonorrhea cases among women in DE. So this was 161.4 per 100,000 persons. And the last one states in 2013, 627 reported gonorrhea cases among men in DE. So this is 141.1 per 100,000 persons. Okay, so the disparity target as of 2010, 69% of all reported cases of gonorrhea occurred among blacks at a rate of 432.5 cases per 100,000 population. So this is 18.7 times the rate among whites at 23.1%. So the disparity is larger for black men at 22.2 times than for black women of 16.2 times. Okay, so again, basically the chart is just showing that how blacks are the race that are mainly affected by gonorrhea versus American Indians, Asians, whites, or Hispanic and non-Hispanic, and the age group that it definitely affects the most are younger age group ranging from 15 to about 25 to 29. Okay, so these are some of the treatment help centers specifically for Kent County here in Dover. The first one is Planned Parenthood. Then you have STD Test Express, James W. Williams State Service Center, MedExpress, and here on campus, Delaware State University's Health Center. So people who should be tested are women who are pregnant, people who are sexually active, who have a new partner or more than one partner, and those, of course, who have unprotected sex. It is also very imperative to use a condom or any other latex barrier like polyurethane male condoms. People who have sex with one partner, just try to remain monogamous with one person who has been tested and unaffected because it just makes it so much easier. The number one thing, of course, would be to abstain from sexual contact at all, so you won't have to worry about getting gonorrhea. And it's best to talk to your partner about having open communication about getting tested. Okay, so the references where we conducted most of our information from was from the CDC, Delaware.gov, PlannedParenthood.org, DHSS.Delaware.gov, MayoClinic.org, and HHS.gov.